All right, well, welcome everyone. I'm Jennifer Larson. I'm training coordinator for the Office of Community Living and hosting our monthly OCL Accessibility Community of Practice. And primarily it's for or intended for Office of Community Living staff, but more people have been joining throughout the department, so everyone is welcome. So thank you all for joining today. And I have put in the chat a pinned link that just points you to our OCL accessibility resources page. There you'll find a wealth of information, but also a copy of these slides if you're looking for that. And that's where we'll be putting the recordings after. So, and I usually send a follow-up email and let people know that as well. So, yeah. All right, so we'll dive into our presentation today. I wanted to talk quickly about some updates that I made to our SharePoint site, so we'll go through that. And then we'll talk about accessible communications, which is something that was folks have been requesting and was on the request forms of people wanting to talk about accessibility in relation to the communications and all that we do for that. And then we'll have some time after that for open forum. So we'll talk about the SharePoint site first. If you guys have been to it lately, you'll see maybe a couple of things that I've changed. So not too much. But one of the biggest changes is that I updated the video display. So I had previously lots of individual videos posted on the page, and that was becoming kind of cumbersome to put all of them out there individually. So I went ahead and made a YouTube video playlist. So this icon over here on the left side of this, or right side of the screen, it's highlighted in orange. That's where you're going to go to find all of our videos. So, and then it just pulls up a playlist. You can watch one, you can watch two, you can watch them all if you want to binge watch for a whole day. That is a big change for the website. And I know a couple of people have reached out and said, hey, where are all the videos? And so that's where they're hiding now. One other, and this is what the playlist looks like when you go there. So hopefully super helpful to be able to find what you need. And then one other thing that I kind of updated on here, wanted to call out, is that I do have an OCL accessibility and plain language request form. And that is really intended to help out OCL staff and for folks who have, wanted to use it to submit a request that way. I get a lot of requests via email, and so that's not wrong. I just had this form out there as well. What has happened within the last month or so is I've gotten a couple of requests through that form from people who are outside of OCL wanting me to review their documents for plain language and accessibility. And so that's where I wanted to call out that form is not really intended for the rest of the department staff. So the button next to it, the HCPUF accessibility plain language and request form, that's actually the communications and design form that Dylan uses for all of his requests for accessibility review. So if you're not in OCL, I would guide you to that form so that you can get your documents reviewed timely. Any questions or things you wondered about the SharePoint site? Okay. You can always put those in the chat. I can just look at the chat real quickly, or just raise your hand when you have a question. So, all right, we'll jump into our topic, which is accessible communications. So we do a lot of communicating here at the department, especially in Office of Community Living, but there are a variety of ways that we're getting information out to folks. So as you all know, we have the memo series. Some folks are doing formal newsletters. Sometimes the best way we can get information out is through email. We have lots of meetings, so there's usually related meeting documents and presentations. Sometimes there are reports that we are creating, formal reports. We also have social media accounts for our department, and of course our website. And there's probably a few more out there, other ways that we're communicating, but there's a lot of ways. So the good news is the basics still apply. So if you are getting a handle on document accessibility and what the basics are for that, then you're going to be pretty good for most of your communications. So those basics are making sure that you're following our brand and style guidelines or using our templates, using plain language, using headings, setting the font and the font size correctly, or making sure that that font size is not getting too small. The minimum size is 12 point. The alt text on images and icons is important to make sure that you're putting that in there. Using descriptive links rather than putting the whole URL on the communication. And avoiding all caps words or sentences, underlining text that isn't a link, and large blocks of italics, and tables if we're using those in our communications. We want to make sure that we're really using tables for data and not just page layout, and ensuring that you do have a table header set. So those are really the basic things. Like if you can do those things, you're going to be, 85–90% of the way there for accessibility for most items. So we'll go through some of those. So plain language, we just want to make sure that we're using clear and concise and well-designed language for the audience that we're intending to reach out to. We want to make sure that we're using that everyday common language and avoiding jargon or complex technical terms as much as we can. I know that's difficult here at the department because sometimes we have to, but at least if we're trying to minimize that or explain those along the way and not just drop them in there. And using that really can help everyone. It helps for accessibility, but it helps everyone understand what we're trying to say, to easily find and use the information. It does help people with cognitive or other disabilities to better understand what we're trying to communicate. And if we're looking to translate that document into other languages, or maybe others are translating our document into other languages, the more simple our language is, the easier it's going to translate into another language. It can also lead to fewer errors in filling out forms, making sure people are following the instructions and doing what we intend them to do. And there is a plain language course out there in Cornerstone, or there's multiple courses. I think there are some self-paced courses that you can find out there. And then I think there's an instructor-led course that you can sign up for. So if you're looking for more help with plain language, there's a lot of resources out there in Cornerstone. So one of the things I wanted to focus on with communication is adding links, and the way that we do that. I think that is a pretty common thing, regardless of format of what we're trying to communicate, whether it's on the website or in a document or a memo or a newsletter. Usually there's a lot of links in there. So one of the biggest things is we want to make sure that they're all working before we publish anything. It's super easy to just like click and copy and paste something in there, and you want to make sure and double check, is it really going to pull up what I need it to pull up? So that's always good to just check. Make sure the link is accurate. Sometimes links that we've had in our bookmarks for a while are no longer updated, and maybe they lead to an error page or something has changed. So just, again, making sure that when you click on it, does it go to where you expect it to go? I always suggest to folks to link to the web page or the source when possible rather than the individual document. Sometimes individual documents can change or be deleted or move around. And so that can lead to, a broken path for the user to, they think they're going to pull up something and then it doesn't actually open. So usually linking to a web page where they can find that information is easier, but it can depend on what you're linking to. You can link directly to Google Documents or a Google Drive. And you just want to make sure that those share settings are set correctly to anyone with the link can view. And so that is something that we are commonly doing in OCL with our website, is linking to Google Documents. And we have some cases where I think not necessarily on our website, but in other cases where we have set up a private drive for like case managers and training. And so we're putting certain training that we can't put on our website. We're putting that out there for them in a shared Google Drive that is specific for them. And I've noticed, I've poked around on the CDPHE page, like a lot of times they're linking to a Google Drive and then just have the folders and the organized documents within there. So that's something that they're choosing to do at their department. So there's a variety of ways to do it. And I would also be careful again about adding in SharePoint links or internal C drive links to documents. I know that seems pretty obvious, but it has happened and I've seen it. So again, it's just making sure that you're copying over that link and pasting in the link that is going to work for the public. Some of our websites have their own navigation internally on each of the pages, and so these are called anchor links. So in the picture on this, or the screenshot on this page, shows a page that I have with some buttons, and they usually just link people further down the page. They can jump to another page as well, but those ones that link further down the page, what it adds to the URL is a hashtag and then a word that I usually name the anchor of. So you can see in the first example, the top of the page, the main URL of the page is just home health program -0. And then the anchor link is actually the hashtag office added to that URL. So you can work with your office's web editor to create some anchor links if you know that you want to send people to a website, but there's a whole bunch of information there and you need them to jump down to a certain section. Talk with your web editor to see if there is a way that you can add an anchor link, or if there is already one. Sometimes they're kind of hidden and they're already there. So work with your web editors on that if that will help kind of guide people to the information you're wanting to point them to. And there's my little highlight box for those buttons. And then there is kind of a new way in Google Chrome that you can create highlight links. So if you don't have anchors on your page, or if it's kind of cumbersome sometimes to put too many anchors on a page, you can use highlight links. And so what you do is you go to a web page and you can highlight a word or a section of that page and right click on that and then select copy link to highlight. So it's an actual, like the menu. I have a screenshot of it here where the menu pops up and it says copy link to highlight. So if you click on that, it's going to save a link that's going to take you to that page, but it's also going to zoom you down to that highlighted text that you've put on that page. And so you'll then be able to paste that link into your document or into wherever you are using that link. So you want to, it creates a really long link. So you want to make sure that you're not like pasting the URL on your page itself, but like using a descriptive text link to point people to that. That can be an easy way to get people to where they need to be on the page without actually, doing an anchor link or some other kind of link. And then be really careful with Gmail links. A lot of times we're sending stuff back and forth to each other through email. Here's the links for that. Here's the links for this. And we quickly just right click on those links that people shared with us and click copy. And then we paste it into our document or our memo or whatever. And so when that happens, we get these really long URL. They start out with URL defense.proofpoint.com. And that is always the clue that this link was copied from Gmail, because Gmail puts all of this garbage in their link. And it works great for us internally or for state folks and those who are in other state departments. But anybody outside of the state cannot click on those links. Well, they can click on them, but they will get an error message that they can't get access to that. So you want to be careful about that. Make sure that you're going to the intended destination of the document, clicking the URL there, and then pasting that into your link wherever you're putting it. And that's going to give you a sound link for the public to be able to use. So printed links. So sometimes we are creating documents that are meant to be printed, and they are flyers or brochures or posters, things that we know that, yes, there's an electronic version, but really we're intending the consumer to print these out, or we're printing them out and passing them out. And so that is when it is okay to use a full URL on your document, as long as it's not overly long. Like you can get some really ugly links. So, if you can use tiny URL, or if you can use something that that cleans up that link a little bit. But there are some use cases where we need to put links on the page and not have them be a descriptive text link. We do usually need to remove the HTTPS from the text. You still need it to make the link work, but usually when people are going to their browser to type in a URL, they don't start with typing HTTPS. So it's just extraneous language that you don't really need on your document. And then it's important also, if you're using QR codes, that you have the link accompanying that, or the URL accompanying that QR code. So don't just give people a QR code. You need to put the URL for the destination of that QR code next to it, just in case people don't have their phone with them. Maybe they don't have a phone that can scan. Maybe they're older, they don't know how to scan a link. And so it just gives them another way to get that same information without having to use a smartphone to get it. Okay, so that was about links. I'm going to talk next about accessibility and constant contact, which I've had a few folks ask some questions about, and how can we use constant contact and make sure that it's accessible. So Constant Contact is a digital marketing platform that we use to send out blast email communications to our stakeholder lists. In OCL, we use it pretty heavily to communicate with our stakeholders. We have a newsletter that we're putting out once or twice a week. Sometimes we have individual notices and announcements that we're using it for as well. And so it is a program that not many people have in the department. So I don't expect you guys to necessarily know this or use this, but there are some folks that do. And so for the people that do use Constant Contact, I just wanted to hit on some of those things. I have some links here on this slide that point to some of the newsletters that we're doing in Office of Community Living or our one-off announcements. If you're looking for examples of those, you're welcome to take a look at that. So in Constant Contact, you can still need to follow those basics that you would for any other document or website to make those accessible. So follow all of those basics. Constant Contact does allow for setting heading levels. So there is a way to do that. You can also adjust or consider color contrast. Maybe you're using a background color and then text on top of that. So just again, wanting to use the lighter colors or making sure if you're using darker colors to do white text on top of that. And then adding alt text to images or icons, the Constant Contact does allow for that. What I'm told that you have to do, because I'm personally not a Constant Contact user, so I'm told that you have to upload images to the Constant Contact media library. And then in that library, where that document is, that is where you can add the alt text to the image itself. And then the more, whenever you use it, the alt text is kind of built into that image through the media library. And there were a couple of resources that I just found on the internet about Constant Contact and its accessibility. The Constant Contact website itself has a video about creating accessible emails. And then I found a review on accessibility.com that talked a little bit about the built-in accessibility of Constant Contact, and also kind of maybe some of the issues that they're encountering from the accessibility community. But they're pretty minimal. I would say Constant Contact is pretty on board with making accessible content. And then with social media requests, those again go through the communications and design team. So if you're going to be communicating in that way, there is a process for getting that information out, and through them, they are the ones that can help you with that and do the actual posting. And so they do have a social media post guide that is actually linked on that form, but I've also linked it here on the slide, that kind of helps you get an idea of what you want to pull together for your social media posts, what kinds of things you need to be thinking about. Obviously, your information has to be very concise and to the point, because usually it's a short little post about something. So just thinking about that when you are working on communications in that way. And then just to touch on accessible website design, like 80% or 86% of website visitors do not read word for word the content on your page. So most people are looking for headings, they're looking for buttons, they're looking for links. They're not there to read paragraphs of text. So if you find that you're wanting to write a novel on your website, just know that folks are probably not going to be reading that very often. So so keep information that you're putting out there in plain language, concise language. You can chunk information into sections if you do really need to put something out there that is longer. Just kind of, making sure that's in a section or maybe in a different place that people can open it and look at it. We do have heading settings in our Drupal editor that allows us to set different levels of headings. With PDF documents, it's helpful to add the title of the document into the properties. And that increases searchability with Google and other browsers to be able to find that document easier. You can add navigation links to your page. Again, if it's a really long page and you want to jump people down to those different sections, our web editors can add buttons and links at the top of the page to help people navigate. And our website editor has a lot of accessibility features kind of built into it. So there's not much with our website inherently that is not accessible. Certainly you can break it, or you can maybe put headings in a wrong order or something like that, where we'll need to. Joel, our webmaster, is pretty good about keeping tabs on all of our pages and the accessibility of them. So he'll often, if he's seeing some issues, he'll reach out to the individual editors and ask questions or see if certain things can be fixed. And I found a quick little article here that there's a link on this slide for the science behind how people read online. And so that might be of interest to folks. I know a lot of us are not web editors, so I don't necessarily need you to know all of this information, but just knowing that there are these features on there and they're kind of built in to how our web editor works. So that's my presentation for communications. We can open it up for questions or maybe other things you want to talk about communications. Anything I missed?
Jennifer, thanks. This is Ryan from the Health Policy Office. That was a really good presentation. There was a lot of really good stuff in there. The alt text is a pain in Constant Contacts. I have learned, I'll just share this with people if it's helpful, that if you copy a campaign, the alt text will also carry over too. So if that saves anybody time, there's a tip. But yeah, a lot of great information. Thanks. I look forward to reviewing some of those links in the presentation.
Yeah, we've tried to do some different things with our newsletters and kind of breaking it up into different categories to make it easier for folks. We've used some icons and images to kind of guide people or just kind of call out different things. So you're welcome to look at our newsletters and get some ideas. Again, I'm not a Constant Contact user, so I will point you in the right direction if you have questions or want to be like, hey, I want to do that. How can I do that? I'll point you in the right direction. So any other questions or thoughts about communications or things that have been a challenge or a question?
I do have one more if nobody has anything else or folks are still thinking. I'm curious about your thoughts about dual language emails and the accessibility of those. And are we getting to a point where most people who need, translated emails have that already built into their phones or their web browsers? I don't know, because I know our website has that tool already built in the top right. I'm curious if email clients are getting that good too, that we could save a little time there, or is it worth the extra time and effort and cost to the department?
I could, to my knowledge, we're not really sending a lot of bilingual emails in OCL, but I could be wrong. Maybe there are certain situations where we are. We have a limited number of documents on our website that we have translated into Spanish. But we really haven't done a lot of other translating. And we're really focusing on like forms and memos or things that are truly going to be handed to a member and have them expected to be, understanding it. So I guess I don't have an answer for emails because I can't say that we're doing that a lot. I don't know if anybody else has any background or knowledge about that from their areas. I also know that for our website, it is nice that we have that translate button and that you can translate it with Google Translate. You can translate it into just about any language. The caveat I've heard is it's Google Translate. Like it's not perfect, but it gets the user something that is probably more usable than what the language that maybe they're not as good at reading. So anybody else on this call had done an email with more than one language in that? Maybe communicating with members, mostly stakeholder. Okay. Yeah. We've probably done a few meetings, again, limited, where we have invited folks that we think might have a different language preference. And so there's been times that we try to get that information out and then have an interpreter, like during our webinar, you can actually have an interpreter. But again, those are kind of few and far between. We're not certainly not doing that for every single meeting that we host. So anything else about communications? All right. Well, I'm going to give you a couple updates and then we'll jump into open forum. Just a reminder that there's other accessibility help. My meetings are only once a month, but Dylan and Ben are hosting weekly meetings where they're open office hours. They do a little bit of training, but it's a great place to just ask some questions or, as things come up. You don't have to wait till the monthly meeting. You can ask them during their weekly meetings. I always need more topic suggestions. I have a few, so if you have other ideas that you want covered in this meeting, you're welcome to fill out this form or the feedback and suggestion survey. Thanks to those who already have done that, so that's helpful. And then just a reminder of our checklist on the OCL accessibility resources SharePoint site is there for you. It's on the page, but there's also a downloadable document of all of that. So it's something you can easily provide to staff. You can give it to vendors or third-party partners who might be struggling with accessibility requirements, with the caveat that if they're a paid vendor, we're not required to really help them at all, but we can kind of give them a nudge, but they really should be in charge of their own accessibility training and knowledge and paying for that. So with that, we're to open forum. So if there's other questions you came here with, now is the time. I'm going to go ahead and stop the recording and we'll get to any topics that you were interested to talk about.